Welcome to Mental Health Matters, a compelling series brought to you by Ontario Shore's Centre for Mental Health Sciences. Every week, we share stories of hope, recovery, and resilience, accompanied by expert advice and resources to help navigate and understand the complexities of mental health. Situated on the shores of Lake Ontario, Ontario Shores is a dedicated public teaching hospital. We provide specialized assessment and treatment services for those living with complex and serious mental illness. Our unwavering commitment to exceptional patient care is built on safe and evidence-based approaches, ensuring successful outcomes through clinical best practices and cutting-edge research. From adolescents to geriatrics, our recovery-oriented environment fosters discovery, recovery, and hope. Mental Health Matters is an opportunity for all of us to learn, grow, and support each other on this journey of well-being. Each episode focuses on breaking down the stigma surrounding mental health through crucial conversations and fostering empathy within families, schools, workplaces, and communities. Join us as we embark on an exploration of the topic of mental health. Together, we make a difference.
Welcome to another episode of Mental Health Matters. Dr. Phil Klassen, Vice President of Medical Affairs at Ontario Shores and renowned forensic psychiatrist, is with us today, and we are going to have a fascinating discussion on forensic mental health. Throughout our conversation, we will explore three segments. In segment one, we will establish a foundation of forensic mental health, its connection to the legal system, and the role of the forensic mental health care team. In segment two, we will explore the Ontario Review Board and take a closer look at the factors that are considered and address any misconceptions that may exist. In the final segment, our focus will shift to the treatment process within forensic mental health. Welcome, Dr. Klassen. Thank you so much for being here today.
Thanks for having me, Julie.
Excellent. So we'll dive right in and get started. Could you explain to our viewers what forensic mental health means and how it intersects with the law?
So forensic mental health processes are defined by statute. They're defined by, at a broad sense, the Criminal Code of Canada. So they're quite similar in all provinces and territories of Canada, because the Criminal Code is a national piece of legislation. And the Criminal Code sets out what kinds of assessment questions and what kinds of rehabilitation priorities each province and territory should undertake for people with mental illness that get in trouble with the law.
Thank you. How does the assessment process aid in determining the mental health and potential risk of individuals involved in criminal cases?
So the pathway through the mental health and justice system varies in length. It's shorter for some, it's longer for others, but of course, as you've alluded to, it begins with assessment. The assessments are driven by specific questions that the judge will have in relation to the particular matter, legal matter, before the court. They may be questions regarding fitness to stand trial or criminal responsibility, most typically, but they can include other pre-sentence questions as well, for example, risk to reoffend. And the care team at that point, or perhaps more specifically the assessment team, will be a multidisciplinary team that will come together to try to respond to the judicial question. That's the first step in a forensic pathway. Some patients or persons being assessed will exit the pathway. After that point, the assessment opinion is all that's required by the judge. In other matters, actually, they may enter sort of the second stage of the forensic mental health pathway, which is the part that goes under the Provincial Review Board, where the supervision, if you will, or the oversight of what happens to that individual derives not from the judge or from the court, but from a review board. Again, a review board constituted by the Criminal Code of Canada.
Thank you for that. My question would be, who determines that an assessment is required?
So the determination of whether an assessment is required comes from a judge. They will typically have a particular set of questions from which they choose one or perhaps more than one. And that question can be answered by the assessment team either on an outpatient basis, so the person who's been accused of an offense could come to the hospital or another facility for an outpatient appointment, or on other occasions, it happens on an inpatient basis. And the accused person with a mental illness is transferred to an inpatient bed for a period of, oftentimes it's 30 days, sometimes it's up to 60 days. Not any bed. It has to be a hospital bed within a facility designated by the Ministry of Health as entitled and funded to respond to the judicial questions. Excellent.
Can you shed some light on how the forensic mental health care team collaborates with the legal system, professionals, and other stakeholders in the criminal justice system?
It's moving from a more traditional to a somewhat expanded model. The traditional and still very important part of it has to do with communicating around the questions posed by the judge, providing answers to the questions posed by the judge. I think increasingly now you're also seeing some expansion of that engagement to involve what's called jail in-reach. In other words, yes, it's important, obviously, to answer the judge's questions. That's part of what we have to do. It's in statute law. It's part of what the Ministry of Health wants of us. But the idea of preparing for treatment, for aftercare, for housing, for those kinds of things for mentally ill people that are in jail is also increasingly becoming a critical piece of the puzzle. And it's not specifically derived from the code. That's more part of provincial programs. So, for example, at Ontario Shores, we have a unit that's not really a forensic unit. It has women in it who have been charged with a crime or crimes, but who have mental illness and who need help to return to the community after their judicial or court process is over. So we're seeing them not actually to answer a question. We may see them later or even before to answer a judicial question, but we're seeing them to treat their illness and prepare them for return to the community. So I would say there is an expanded role for mental health providers now compared to the sort of core role that we saw earlier.
From a very high level, what does the forensic program look like at Ontario Shores?
The forensic program at Ontario Shores, as is typically seen in other designated hospitals in Ontario, involves multidisciplinary teams that serve both inpatients and outpatients. So the inpatients may be assessment inpatients, as we'd said, still trying to answer questions for the court, or they may be rehabilitation inpatients, persons whose court process is over and they're now under the Ontario Review Board. And then when they get better and better, then they become outpatients. And so we also have an outpatient team here as well. We also provide care for, as I'd indicated, for people on an inpatient basis, women who are in the provincial custodial system here. And we also do some video conferencing into jails.
Excellent. I imagine one of the questions we get as part of the communications team at Ontario Shores talks about risk assessment. So what does risk assessment look like, and what role does it play in forensic mental health?
So risk assessment might at times be the central issue on a pretrial basis. That's while the person's still in court. That may be the judge's question. Risk assessment is, of course, always in the back of the mind of any forensic professional, whether that is a sort of a question right in front of you or not. Risk assessment becomes a really important issue, again, once they're under the review board, after their court matters are done. Again, from the statute, that's the number one job of forensic professionals at Ontario Shores for people under the review board, is to protect community safety.
Thank you so much, Dr. Klassen. It's a pleasure to have you here. Look forward to bringing you back for our second segment where we discuss the Ontario Review Board. Welcome back to Mental Health Matters. Thank you, Dr. Klassen. Looking forward to this discussion on the Ontario Review Board, or ORB. My first question, could you please explain the role of the ORB?
Sure. The role of the ORB is to oversee the risk management and rehabilitation and reintegration of persons with mental disorder who have been found either unfit to stand trial or not criminally responsible due to mental disorder. This role in Ontario is parallel to the review boards in all other provinces and territories. In other words, in every province and territory, there is a review board which derives its authority from the Criminal Code of Canada, which is tasked with protecting public safety and also ensuring the rehabilitation of the person with mental illness.
What happens if someone we know or love or care about ends up being managed by the ORB?
So there are many possible outcomes. So it's difficult to give you one unequivocal kind of response. Again, the thrust is to protect public safety while maximizing the rehabilitation of the person with mental illness. It can involve different kinds of therapies, medication. It can involve higher security units if the individual is still having a lot of struggles with mental illness. It can typically will involve cascade down to lower security units as the individual gets better, and then a return to the community. And when that individual is deemed no longer to be a risk to public safety, then they are absolutely discharged from the Ontario Review Board system.
When making decisions through the ORB process, what factors are considered to strike a balance between, of course, the rights of the patient and the public safety?
So the ORB process itself has many balances and checks in it. So the review board is a panel of 5 persons that includes legal professionals, mental health professionals, and always one layperson, somebody drawn from the general public who is neither a legal professional nor a mental health professional. The person, the patient under the ORB has counsel, Crown Counsel is there, the hospital team is there, and the hearings are public. Any person in the community can come to any Ontario Review Board hearing. Further, the documentation relating to that hearing is also public. So it's a very transparent process. And it is, as you've alluded to, it's a balancing process. We want to maximize the rehabilitation and liberties of this person, the person with the mental disorder who's under the ORB, while at the same time, number one priority is the protection of public safety. And there are a number of tools that can be used, including treatment and care. It can be hospitalization. It can be a certain frequency of outpatient visits that are required. It can be not being allowed to use alcohol or cannabis or those kinds of things, or a requirement to accept certain kinds of treatments. There's a range of, I'll say, conditions, or some could say levers, that the ORB can put in place to maintain public safety, but also to promote the welfare of the mentally ill person.
Certainly sounds complex. Do you have an example of or a case study that highlights the complexity and challenges involved in the ORB process? And how does such cases shape the decision-making and outcomes?
So the complexity tends to increase, this is maybe a little bit oversimplistic, but tends to increase with the number of diagnoses that are present. So if you have a single diagnosis that responds well to treatment, the situation tends not to be so complex. For example, if you have somebody with a psychotic illness who has a beautiful response to antipsychotic medication, not having been on the medication or not having been on it long enough for at an adequate dose previously, they can respond extremely well. Their risk can be reduced quite quickly, and their trajectory can be pretty straightforward through the process. Where things become more complex is where there are multiple diagnoses. So let's say if somebody has, let's say, schizophrenia, but they also have a serious substance misuse problem, and they have a serious trauma history. So they've got problems with PTSD and related kinds of challenges that give rise to emotion problems, emotion dysregulation, mistrust of authority and of the treatment team. Then the treatment of the substance misuse problem and the illness becomes more complicated, and the review board must take into account, and the treatment team, all potential sources of risk. So if you have multiple diagnoses, and therefore potentially multiple sources of risk or unwellness, it becomes more complex. The other thing that can make things quite complex is if the person really lacks supports. If they're being returned to a community that lacks professional supports, if they don't have personal supports like family that care about them, if they're being returned to areas that are geographically quite distant, from where professional supports are, those things can also increase the complexity of managing that person. And the combination of multiple diagnoses and the absence of good supports is maybe the most complex of all.
Definitely. Thank you for clarifying that. What are some common misconceptions, and how can we better educate the public to understand the purpose and function of the ORB?
I mean, I think one of the common misconceptions amongst the public is that people under the ORB are people that kind of got away with something. And I want to really reassure the public that that's really not the case. The process in getting a person to a position of being found unfit or not criminally responsible is A, very open and transparent, B, tends to involve pretty exhaustive assessment, and C, involves very, very careful scrutiny by the legal system. So I really think no system is absolutely perfect, but the notion that people are getting away with something, I think, is not true. I think the other thing that I would say, one of the misconceptions, is that there's a great deal of stigma associated with forensic patients. In fact, if we look at the outcomes of individuals found unfit or not criminally responsible, and there is such a project in Canada right now. It's supported by the Mental Health Commission of Canada, called the National Trajectory Project, that's looking at the multi-year outcomes of these individuals. Their outcomes are excellent in terms of recidivism, very low rates of recidivism. So it's a very careful process that produces very good outcomes, as opposed to a questionable process that allows people to go free and get away with things.
What do we know about the outcomes of these individuals?
We know that their recidivism rates, long-term, multi-year recidivism rates, are well under 10%. And that compares very favorably to other individuals managed by the criminal justice system. They are superior outcomes.
Excellent. I know you talked about two misconceptions, one being stigma and one that perhaps the individual got away with something. Something you typically see, and I'm going to relate it back to social media, is that like someone has faked a mental illness exactly to get away with it. That's something I imagine not easily done.
It's something that, in my experience and over the course of my career, first of all, I see people attempting it far less. I think because we now have such sophisticated information gathering processes in terms of trial materials and careful and sophisticated assessment processes, I think these days, first of all, you hardly ever see people trying it anymore. And secondly, I think it's extraordinarily uncommon that actually happens. Again, I'm not saying the system is perfect and that we don't make mistakes, but it's set up to be highly scrutinizing of what's happening to these individuals, and I think it's succeeded in that respect.
Thank you. Thank you for bringing some clarity to a process that is undoubtedly something that I think a lot of people have questions on. Welcome back to Mental Health Matters. In this final segment, we'll explore the treatment process within the forensic mental health system. Welcome back, Dr. Klassen. What factors are considered when developing individualized treatment plans for people in the system?
Sure. And you're right, the treatment plans are individualized. So what we would look at, we have a general sense from the literature on this subject, what are key risk factors for reoffending? We would take a look at that particular individual and say, which of those risk factors do you have? And we would try to build a treatment program that addresses their specific risk factors, take into account what's called their responsivity factors. In other words, how do they learn? How do they acquire skills? How do they receive therapy? How do they respond? So it's a combination of identifying the risk factors and then choosing a pathway of care, treatment, rehabilitation that they can respond to.
What, again, very much a hospital term, so feel free to rephrase, but when we look at or consider the length of stay in the forensic mental health system, what is typical and what factors influence that?
That's a great question. The challenge is it isn't always typical. There are considerable variations, not only between individuals, but between hospitals and even between provinces in terms of length of stay. And some of these factors are not that well understood. The length of stay of forensic patients is considerably longer than in what we call the civil system or the sort of regular mental health system. There, it's often days to weeks. In the forensic system, it's more typically months to years. The factors typically involve risk. Put another way, given that our primary consideration is protecting the public, if the treatment team is struggling to reduce risk, either because that person's illness is treatment resistant or for whatever reason, they've got a number of different risk factors, a number of different illnesses, their stay may be longer. And then, as I'd mentioned in a previous segment as well, what are the opportunities to manage that risk in the community? You know, to the extent that they have good social supports, that they have family supports, those kinds of things, that they have a place to go, maybe a high support, highly structured living situation in the community, they may be dischargeable earlier because of the nature of what we can give them there. To the extent that that's absent, they may have to be in hospital a little longer.
I feel you've touched on this a little bit, but what are the main challenges in providing treatment and support to individuals with complex mental health needs in a forensic setting?
I would say the challenges are probably related to what kinds of difficulties those persons come to us with. So to put that another way, the review board system has lots of good treatments available, lots of good people in it, an excellent oversight system, and it's well defined in what it does by statute. But typically, the people that wind up in the forensic system, our patients, the people we look after, are people that have more illnesses, more diagnoses, more social determinants of health challenges, because if it was easier, they would have been effectively treated in the civil system, in the regular mental health system. So I would say our biggest challenges are the fact that these are the individuals that couldn't get well in the regular system. And so there's some extra engagement, effort, therapies, processes that are involved for them.
You've touched on a number of the variables that impact patients who are on the road to recovery. Can we discuss just for a moment the importance of community support and perhaps what communities could do to better support forensic patients as they reintegrate back into community?
So community support's very important. Often that's provided by family, carers, other people that are in a family kind of position potentially with that patient, and also professional supports, housing support, community mental health support, etc. What I would say is, a lot of people may have forensic mental health patients living in their community that they may not even know about. Because generally speaking, these patients do really, really well. Their outcomes are good. And so I think the key thing that I would like to see from the community is the sense of we should be hopeful about these individuals. We know that they do get better. We know that they, most of the time, stay better because we have data on this. Just a sense of general hopefulness about, first of all, mental illness, to begin with. And secondly, even those mental conditions that bring people in conflict with the law, things can get a lot better.
Two things you said, that they get better and stay better. Those are two really, really important points, I think. Circling back, involving families in the treatment and recovery journey is important. We know that. How does family involvement play a role in supporting individuals in forensic mental health? I know that we've touched on this throughout this segment, but if we could really focus in on that for a moment.
I would say that family is helpful both in sort of more general ways and in more specific ways. And more general ways, obviously, having a network of people that support you socially and that care about you and are there for you when things aren't going well, et cetera, is important for all of us, not just people that are patients in the system. But the other piece of it is that actually family members can be integral to preventing relapse and recidivism in people with, let's say, a psychotic disorder like schizophrenia. And one of the things that we offer here to every patient with schizophrenia or a psychotic illness, whether they're in the forensic system or the non-forensic system, is what's called family intervention training, or FIT training, something that comes out of the UK and which gives family members a special role in preventing relapse in people with schizophrenia. So, and of course, family members may also be the first eyes and ears if somebody is going down the wrong path, if they're returning to substance misuse, something like that. Family members, in addition to being part of a therapeutic process, can be part of a risk management process.
Excellent. Beyond psychiatrists, which other professionals are part of a forensic patient's mental health care team?
The number of professionals involved and the intensity of their involvement may vary somewhat depending on where that person is in the journey, from assessment to inpatient rehabilitation to outpatient care. in no particular order, in addition to forensic psychiatry, of course, nursing may well be involved in their care, certainly if they're inpatients, social work, occupational therapy, psychology, pharmacy, recreation therapy, behavior therapy, particularly for individuals that may have some intellectual disability, and peer support. I hope I haven't missed anything, but it's a whole range of different professionals. And again, at certain times, certain professions may be more engaged, providing a particular therapy or a particular bridge, let's say, to the community. And then at other times, it'll be a different group of professionals in that journey.
Excellent. Thank you for sharing that. As we wrap up this segment, is there anything that you think is really important to highlight for our viewers as we close as it relates to forensic mental health?
Again, I would like to impress upon people that really these are people with mental illnesses that you are going to see at other hospitals, other treatment facilities in Ontario and elsewhere, that just for whatever reason have not made it to recovery in the, I'm going to call it the usual system, but that we should be extremely hopeful about their recovery in this, I'm going to say, somewhat more intensive system, somewhat more intensive stream, and the data nationally bears out that cause for hope.
Excellent. Thank you so much for joining us today. Thank you for joining us for Mental Health Matters. Take care, and remember, your mental health matters.
Hello there, this is Karim Mamdani, and I'm proud to introduce myself as the President and CEO of Ontario Shores Centre for Mental Health Sciences. Thank you so much for tuning into today's episode and for joining us in these important conversations about mental health. I just wanted to take a moment to express sincere appreciation to the incredible team at Ontario Shores for their exceptional work. Our team of compassionate and skilled clinicians and staff work tirelessly to provide life-saving treatment and unwavering support for our patients and their loved ones who are facing the challenging impacts of mental illness. At Ontario Shores, recovery is possible and there is hope. I invite you to visit ontarioshores.ca to learn more about our work. On our website, you can explore our career and volunteer opportunities, learn about our programs and services, and find out how you can make a difference through donations.